Discovered in recent times and is already claiming thousands of lives across the globe and accelerating at a very high rate. The coronavirus has become a global health alarm. The Gambia now records third confirmed cases of the pandemic. As cases of the coronavirus unfold in the country, many are left in an overwhelming feeling of fear and anxiety. The people are now considering the condition of the country's healthcare system. Are the resources really available to contain the spread of the epidemic? Well, this is MRC currently handling all the coronavirus cases in the country. But how prepared and equipped is this medical facility to navigate through this unprecedented time? In the wake of the coronavirus, this big medical facility has become the country's central hub, conducting laboratory tests of the pandemic. At a time where health workers around the world are facing an unprecedented workload in overstretched health facilities, the risk to doctors, nurses and others on the front lines has become plain to aid the afflicted and help halt the spread of the virus. Officials told GRTS as soon as MRC receives the news of the epidemic, they considered all the potential gestures by setting up the diagnostic test and employing all the stable tactics to wait for the arrival of this global health menace.
There is action to expand this facility also to national public health laboratories. We also would like to expand this diagnostic facility also upcountry, because at the moment it's only here at the coast. For the time being, we have done altogether 52 tests and we identified 3 positives.
This is taking a joint effort to contain the virus in the country. MRC offers great support to the Ministry of Health. They've already identified 2 rooms for quarantine at MRC, and the 2 confirmed patients are under intensive care. Dr. Davis NWAKANMA, head of laboratory management, told GRTS that MRC has the capacity to conduct all the laboratory tests of COVID-19.
Confirmed case, as far as we know, that's a confirmed positive, actually came to our clinical services department, that's the MRC's hospital. And then we got the results, ran the test. Unfortunately, it was positive. But good enough, the individual had already been flagged up as meeting all the criteria and feeling some symptoms. And so the isolation and the quarantining really happened very smoothly. But we ran the test and returned them the result, and we are doing the monitoring.
With a lineup of clinical laboratories, a domain occupied by laboratory equipment and clinical experts, determined to explore every avenue to ensure all the possible solutions to the epidemic are available. Here is where all the coronavirus samples and other infectious disease are monitored, a highly sensitive and well-protected section. We explored the laboratory sections with Dr. NWAKANMA. He said being infected by the epidemic is not attached with immediate death. But if the preventive measures are not observed by the public, there might be an increase in cases, and that will be difficult to control. At a situation where many believe pressure on the healthcare workforce will intensify in the coming weeks, MRC is putting up sufficient inventory measures of personal protective equipment for responding to a such event. To enable its health workers to do their job safely, resources are dedicated to providing gowns, gloves, and medical-grade face masks, and also arm them with the latest knowledge and information on the virus. Here, the medical personnel are being trained on putting and doffing off the personal protective equipment for safety purposes. The dissemination of accurate information concerning the virus has become a hitch in the mission to overcome the disease. Experts believe the misinformation can cause public panic and slow down solutions. MRC Communications Unit has taken up a significant move to produce posters, booklets and videos geared towards giving accurate sensitization about the virus. It's a daunting task for the medical personnel, which requires a rigorous approach on a disease causing a global health emergency, requires the health sector to garner more resources and build the capacity of the medical personnel and brace up for this difficult situation.
MRC has become the country's medical bedrock on the ground to combat the coronavirus epidemic. This institution also understands the need to act quickly and decisively in order to avoid the increase of cases. Meanwhile, the medical personnel continue to caution all and sundry to adhere to the precautions to prevent a spike of cases that might stretch the medical system beyond its limit. Reporting for GRTS News here in MRC, I am Aminata SANYANG.